A stroke is a generic term that describes any serious event in the brain. A stroke is a life-threatening emergency which requires medical attention immediately. A small number of strokes are due to hemorrhage and bleeding in the brain. The majority of strokes are due to atherosclerotic disease, atherosclerosis, and blockage of arteries in the brain. It's very important that patients seek medical attention the second they have symptoms of a stroke, because we have the motto that time is brain. The longer a stroke goes untreated, the more likely it is that there will be irreversible brain damage. The symptoms of a stroke can vary, but the most common symptoms of a stroke have to do with problems with speech, weakness in the hand, difficulty finding words. Sometimes patients can have drooping of the face. In some cases, if it's a massive stroke, the patient may develop profound weakness in the entire half of their body. In other cases, they can basically collapse. So sometimes patients with hemorrhage, especially, that's a certain kind of stroke, they can get a very severe headache. We call it the worst headache of their life. And then they can have anything from weakness in the face to weakness in the arm to coma. The most important way to diagnose a stroke is to get a CAT scan of the brain. It's an X-ray. Everyone's heard of CAT scan machines. It's basically a rapid sequence X-ray that takes circular pictures around the body and gives us an image of the brain in 5 to 10 seconds. Based on that, we can tell which kind of stroke it is. If it's a hemorrhage, that's treated in a totally different fashion than the usual strokes that we worry about. A hemorrhage is bleeding in the brain, and that can be due to multiple causes, but we need to know if it's a hemorrhage or not. If it's not a hemorrhage, then there are medications that can be given depending on how long the patient has waited before he or she seeks medical attention.